dreams holding us closer.
Hi guys, welcome to my channel. This is Too Cute for Cancer, and my name is Jody, aka Jody, and I have been living with stage 4 metastatic triple negative breast cancer for 9 years, but I've been battling cancer for 21 years this September, coming September. So today I'm kind of doing a step back in what I probably should have done on an earlier video, but I just got started and I got on a roll, and until this came up to be a big issue for myself, I didn't think about putting it out there for you guys. But now that I have had a miserable week and missed my Sunday upload, I'm so sorry you guys. This seems to be a very prevalent topic, and so we're going to talk about it today. But first I'm going to take a sippa. We're going to talk about the 3 mores. And I apologize, I don't have makeup on today. I have just a little blush and powder and my eyebrows. I just was not feeling it today. So anyway, we're going to talk about the 3 mores. Not s'mores, but mores. Pain, scans, and cancer. Those are the 3 mores that I keep just coming up with again and again and again. It starts out with pain, which leads to, I'm having this pain here, I'm not sure what it is. Then it leads to, let's do a scan and find out what that pain means. And then unfortunately, most often in my case, it means to more tumors. So we're going to talk about that today. First off, more pain. When people come up and ask me, how do you know, I have this pain in my elbow, and it's serious. I mean, they're having a bad pain in their elbow. I have a pain in my shoulder, or I have a pain in my long bone, on my right long bone, on my leg. And they say, how do I know that's not cancer pain? That's the first thing they ask. How do you know your pain is cancer pain, or if it's just old lady pain, or I hurt myself running in, in the triathlon, or, whatever. So I want to talk about that a little bit because I get that question so often. For me now, when I get a pain, I can tell usually if it's arthritic pain, if it is chemotherapy pain, something that is related to that, like neuropathy, or if it is something new that I don't know about, and I can usually tell it's something that's not good. So, but what I tell everyone that comes to me, if it is let me see. If it is a sudden onset of pain that you've never felt before, and it may come and go, but it's never just gradually been there and worked up to bad, I would get it checked right away. Any sudden onset, I'm sorry you guys, I'm just hot today. I drink hot tea and now I'm hot. Having those granny flashes too does not help. Okay, anyway, if it's a sudden onset of pain that you've never felt before, in a place you've never felt it before, then I would go get it checked. If it happens like a couple times, just not one time, but ow, that really hurt for a length of time, like maybe it hurt for like 20-30 minutes, then it went away, but then it came back in the same spot and in the same way, and wow, I think I should get that checked. So those are my tips to you who are going through maybe just regular pain and you're thinking maybe this is cancer. Always err on the side of caution and get it checked out, of course. But for the normal person that just comes up and asks me how I know, and I've studied too, doctors will tell you if it is a sudden and it is in one spot and it comes back and then gets worse and gradually gets worse and doesn't go away, that is definite indication for scan time. Now, if it is a pain that is in your joints, in your knees, any joint at all, and you wake up and it aches and stuff, and then it gradually gets better throughout the day, that doesn't usually tend to be a cancer pain. That tends to be, unless you've already had cancer and then your body is, changed from it. But just a normal person who has never had cancer, they wake up and they like, oh my gosh, I wake up every morning, Jody, and I can't move. I think I might have cancer. What do you think? Number one, again, not a doctor. Number two, just from my personal experience and from listening to the doctors, it usually means that you have like some kind of inflammation in your body, and arthritic pain could be it. So that doesn't tend to be cancer. However, there are blood cancers like Hodgkin's lymphoma that do send a specific pain to one part of the body, and then your joints start hurting. So, but most often waking up with achy bones and stuff is just waking up with old achy bones. So, okay, so that's how, when they say I have more pain, I don't know, maybe I have more cancer. For the majority of people, that's what I tell them the differences is. Okay, now for myself, I know what my cancer pain is and what it is not. When I wake up and it's cold and I just need to stretch it out, I know it's arthritic pain. If I wake up and I have a stabbing pain in my hip or in my spine, I know that that's my cancer, because that's where my tumors have been, and that's where it ate into the column of my spine and ate away at the bones, because the tumor was in the bones. So it has taken it from this and gone like that, and it rubs and it hurts. So I know, for me, that is cancer pain. That is a sign that something is not right. And the question has to be, is my cancer growing again? Or is it just the damage that the cancer did from previous is just acting up? So those are the two things for me. But if there is some onset of pain, like my head, that's another big, huge, like I have a headache, instant MRI for me. Because as we know, with triple negative and stage 4, the next spot for my cancer to stop, other than the bones, would be to my brain. So that is a big, huge red flag if you have cancer and you get a headache. People that have headaches regularly and they say, oh, it's probably just my my migraines, I've had them all my life. Well, when you have cancer, all that goes out the door. It's a clean slate, and you say, I have a migraine, I need to get this checked out. So that is important to know. Okay, then what happens is they send you for scans, of course. So I'm going to use me as a guinea pig because I've been going through it. In fact, I go for more scans tomorrow. You tell the doctor, I have pain. Now, this is for somebody who is not a cancer patient. You say, I think I have cancer, doctor. I have a pain in my elbow. I have a pain here. I have a pain there. They rarely look up from their writing pad. They just look at you and say, okay, how have you been sleeping? Have you been depressed lately? Ask you a whole bunch of questions. And then, if you have a good doctor, they'll say, okay, where does it hurt? Where does the pain start? Where does it go to? Then you can be confident they're taking you seriously, for one. And then you can ask them questions. They ask you questions, and they ask you questions that are going to rule out cancer. They're not just randomly picking questions to throw in your face. They have questions that they ask that if you say yes to, then they're going to ask you a whole bunch more questions. And then if you say yes to one of those questions, they're going to ask you a whole bunch more questions to that question. So, but if you say no to all of the first 3 or 4, whatever it is that they use to scan, kind of filter out the good and the bad and the ugly, then you can say, oh, okay, he's not worried, I'm not going to be worried. Okay, that's a good thing. Your doctor's not worried. But if the pain consistently comes back in the same spot and he doesn't have an explanation for it, I keep going back until you get a scan. And a lot of times they'll say, no, you have to try this, you have to try that. But you know what? That's because of the insurance, but you can go back and you can keep saying, no, I'm serious, I need a scan. And then they have to do it for you. Now, do they have to do it 3 or 4 times for you every time you get an ache or something? No, they do not. But first time's a charm. Okay, so the type of scans that usually they start out with is a a CAT scan. And that's just when they don't normally start with contrast. They just stick you in and get a scan and look through your body to see if there's any hot spots, anything that sticks, that doesn't look good in there. Then sometimes they'll say, okay, come back in 6 months, we'll do this again. And you'll be like, what? And they'll explain that, I saw a little shadow over here, but that could be, did you have any sports injuries? Or, they'll ask you a bunch of questions like that. Okay, that could be that, but let's just watch that spot. Come in 6 months, they'll do it, or 3 months, whatever it is. And then they'll compare your scans and they'll be like, that shadow grew. Then they know we need to get in and we need to do more stuff. Then they'll do a PET scan. They'll do it with contrast. And then sometimes they'll, depending on what they're suspecting, they'll do, the brain and bone density. They'll do anything and everything to figure out what it is. But most of the time, they can tell from the very first scan that something's up. Okay, so now that's where I'm at right now. I have been ignoring going to the doctors because I just don't want to I just don't want to do it again. I'm so tired. I'm like, I do not want to have to go in and be stuck under, shiny metal objects. I would rather just ignore the whole thing and hope it goes away soon. But considering that the pain has been progressively worse and it is in my cancer zones, and they did find a tumor on my sternum 4 months ago, and we haven't addressed that yet. Still haven't had my biopsy. If anybody's been following me, you'll know that was a big issue with Kaiser. I scheduled it. You know what? I'm not going to tell you about it. I'm going to drop a link up here and you can click that and get caught up. Anyway, so no, I haven't done my biopsy, my needle biopsy yet, and I really I'm wanting to do it. The doctor's not wanting to do it, and they're dragging their feet. So they just want to start me on the chemo pill and do a maintenance. And I am like, no, because I want proof positive. I want it in front of my eyes. I want to see my scans. I want to get my lab work. I want it all in front of me. Then I'll decide what I'm going to do. So, and sometimes you have to be that way after you've been doing it a long time, because they just keep you going in the more pain, more scans, more pain, more scans, more cancer. It'll just go in a circle. And then they'll just give you more chemo and more medications, more steroids, more what have you. So sometimes you just have to say, no, I want to make sure that you're not just labeling me. You're not discriminatory against cancer patients now, are you? I want to know. So I want to see proof positive that in my scans, in my lab work, that this is not just from the last tumor and it's messed up my bones and it's calcified. I want to know that it's actually a tumor before you treat it as a tumor. So that's the battle I've been going back and forth with the tumor on the possible tumor on my spine, or on my sternum. So now, since then, I have been extremely tired. However, I have been working full time and driving back and forth to Idaho on road trips. That could be it, but the last 2 weeks I have just barely been able to get out of bed. The spine pain has been worse than ever, and I know you're going to say, Jody, you sat in a car all that way, and I do know that's a good possibility that it could just be from that, but I woke up this morning and I had a jabbing pain in my hip, and I'm like, that's another one. So I am going to go and do my scans tomorrow. I promise. What is it? What is promise in, well, I know promise in sign language, but promise for, I promise. Okay, so I am going tomorrow, and I am going to check out my scans and stuff, and I also am going to get labs done tomorrow, which will tell me if my cancer markers are up, if they're down. Last time they were down, so it's another reason I didn't panic. I want to also see if I need blood transfusion because I've been feeling extremely tired, and usually that means I'm anemic and I have to go and get more blood. So I'll be checked for that as well. So anyway, now for the person that is not me, that is not many of you, unfortunately, that does not have cancer and is just thinking, I'm going through it, I found a lump in my breast, and I'm going to the doctor and I'm going to find out what those scans said. Okay, this is the hard part. This is the waiting part. This is the part where everybody's minds jump to me. Like, I got cancer like Jody and I'm gonna die. So no, don't even do that. Don't do that to yourself, because do you know how many scans I've gone in for and nothing's been there? It's been fine. A lot. So don't even go there. So you go in and you sit down and they say, well, we found a lump here. We want to wait and we want to do another mammogram on that. And then we're going to do an ultrasound on that. And then we're going to do a needle biopsy on that. And it's a process. All through that process is just that. It's a process to make sure that what they saw is just a calcified nothing. So first off, don't jump to the worst conclusion, because I don't know what the percentage is. I think I'm going to look it up. But a very high percentage of situations that come back are not cancer. So that should make you feel better. If it does come back with cancer, then still don't jump 10 feet, don't jump 10 steps ahead. Just stay where you're at and just look at your situation. I'm walking, I'm talking, and I'm breathing. My heart is moving in the right direction. It's pumping. I'm okay, and I'm okay right now. And don't jump way far ahead. Do you know what? When my cancer became stage 4 and it moved into my internal organs, and they had to take my kidney out and part of my stomach, and then it went to my bones, they told me I had 18 months to live. And I just sat there and I was like, how do you know that? How do you think that you know that? Are you God? Because I don't think you look, because I didn't die in 18 months, because they're going to be like, darn it, I was going to take her mattress and I wanted her Mini Cooper, and just kidding. In our family, we joke a lot, so you just have to, that's how we deal with our grief. So if it is cancer, you know what? There's so many things they can do. My doctor, my sweet oncologist, she said that having an iPhone, you know how fast new iPhones come out? That's how fast new cancer treatments come out, and new trials and new studies come out. So what is happening with me right now and how they're curing or taking care of my cancer and maintaining my cancer is not what they're going to do to you in 5 years or 10 years or maybe even 1 year. No. So just stay in the moment and stay calm and get your information, and make sure that you don't let anything slip by. Sometimes when you go in, you're a little bit, your mind's a little fuzzy. Just bring somebody with you, bring a recorder and record the meeting so you can go back and make sure that you got everything right. Because sometimes when you hear the word cancer, everything else is twirling around in your brain, and it's not the same thing as what the doctor's saying, and it doesn't match, and you're getting all, and you missed some valuable information that you needed to hear that day. So there you have it. Okay, so that is more pain, more cancer, no, more pain, more chemo brain, more pain, more scans, more cancer. So that's where I'm at right now. I'm waiting to find out if it is indeed more cancer. So I know that a lot of you have messaged me and say that you are in the beginning of your journey, and I just want to encourage you that the beginning of your journey does not always have to be followed by the end of your journey in the way most people think about cancer. The end of your journey will be most likely successful. You beat it. You can wear a champion's, I beat cancer's butt t-shirt if you want, and I bought it, or whatever the new shirt is out nowadays. So I truly believe that will be you guys. So, and if it isn't and you do end up in my spot, you know what? There's a lot of good living to do with cancer. Okay. Now, if you have not been following my channel and you don't know our beautiful community here, we have the most positive community that ever could be. I mean, you guys are amazing, and we're growing fast, and we've been able to keep that nice, tight, positive attitude, and I'm really proud of everybody for that. I don't think I've even had maybe one troll. That's it. That's not bad, right? For almost 2 years, not bad. Okay, if you'd like to join our family and hit that subscribe button and support me in my journey, I would love it. If you'd like to set your bell to notifications so you don't miss any of my goofy talks like today, then hit that bell button as well. And I will see you on Sunday here at Too Cute for Cancer, and hopefully looking a little bit better and maybe have some answers for you. All right, you guys, peace out.